Our first presenter is going to be Nicole Turner. Nicole is a Kamilaroi woman who currently lives in New South Wales on the coast. She's one of very few qualified Aboriginal community nutritionists, and I believe she was the first. She's also chair of Allied Health Australia, Indigenous Allied Health Australia. I happen to be patron, but so I know Nicole very well. She's an adjunct professor of nutrition and dietetics at the University of Canberra, and Nicole is an Aboriginal Workforce Engagement Manager at Rural Doctors Network. She has published numerous papers in international journals and presented at several conferences around Australia and overseas on a variety of topics, especially Indigenous health. Her passion is nutrition and living a healthy lifestyle. She's been trying to work on me, but I haven't quite got there yet. She believes we need to give knowledge to our people about the importance of maintaining a healthy lifestyle and preventing chronic diseases. She's involved with many national, state and local committees and organisations. And so can I invite Nicole up here to give the first presentation. Thank you, Nicole.
Thanks, Tom, for that introduction. Before I start, I'd like to acknowledge the traditional owners of the lands we're on today and thank them for having us here and coming together for this really important day and making sure the weather's nice and cool for us people that come from the coast and don't really handle it that well. And we're a bit of sooks up the coast, I think. So I'd also like to acknowledge Mrs. Poche and the Poche family, as you mentioned this morning. Thank you for making sure this happens. And also there's a few IAHA members in the audience, so thank you for coming to listen to me, and you already know what we do, but thank you for support. And there's a couple of IAHA staff, so thank you for coming. It's not all IAHA, sorry, so there is other people in the audience, so thank you also coming. And also wanted to thank Bo Rambolini and his team for organising this. Well done for organising this day, and this morning we had a good breakfast this morning. And my time will be up by the time I finish acknowledging people. And also Rural Doctors Network, who I work for and let me do the work I do. So does everyone know who IAHA is? Is there anyone that doesn't know who IAHA is? Okay, so is everyone members or associate members? Yep, if you're not, by the end of the day, you will be. By the time you leave, because you know how great we are and the work we do, you want to be involved. So what we are is a national not-for-profit member-based Aboriginal and Torres Strait Islander allied health organisation. We're established in 2009, so this is our 10th year, and we're having a conference in Darwin in a few weeks, so hopefully the question is, are you all registered? So just say yes, and if you're not, you can get onto that very soon to register and just tell your bosses that you need to be there because it's really important for your leadership around Indigenous health to be at our conference in Darwin. And so there's some of our members, and that picture down the bottom is we do work all around the country, but that's at Barunga. We go to Barunga Festival each year, and I do nutrition work up there with the kids at the festival, and it's a really great time for us. So this is part of our strategic plan that we work towards each year, and we're starting a new one next year, but this is what we believe in for our members and for our Aboriginal and Torres Strait Islander people. So support, grow, transform, lead. I won't go right into that as I have got little time to go in. If anyone knows me, 15 minutes for me is really a very short time. So this is who we are and what we do. So we have 28 disciplines. So we have a lot of different disciplines to normal allied health, mainstream allied health associations. So we have 3 categories. We have full memberships, associate memberships and corporate memberships. We also include paramedics in our membership, public health, dentistry, mental health practitioners, pharmacy. We do that because mainly because they requested to come into our membership, but it's also about holistic health for us as Aboriginal people. You can't just have selected workforces, you need the whole workforce involved. This is our membership, so we have members all around Australia. As I said, we're a national organisation and we have 1,600 members, and you can see the breakdown of Indigenous membership. So we're very proud to have members all around Australia that do a lot of work for us also. So this next one's really interesting. I'm not sure if a lot of people have seen this before, but this is our Indigenous allied health workforce. So that's how many we have in the workforce. So we know we've got a long way to go, less than 1% in a lot of the professions that are Indigenous. So we've got a long way to go to make population parity and also need for our people. So we work hard at this, and a lot of people in the crowd know how much work we do also around this. This is some of the initiatives which I'll get into as we go along, and as you can see, we do a lot. We're only a small group of people. We're growing our staff, but I think we've got about 10 now, which is great. But what we do around the country is wonderful, and this is some of the initiatives that we do around the country, and I'll talk a bit about a few of those as we go on. This is something that we're very proud of. We had a really good, successful mentoring program. So we do member support, personal, professional and cultural mentoring, which is really important. We have a lot of our associate members which are non-Indigenous and get in contact with us and say, can we join in with your mentoring program? We'd like to know more about cultural safety and responsibility that we do a lot of also. And leadership development, I have a few mentees at the moment that working on leadership and development with them, and they're not only students, they could be mature age people just wanting to know a bit about leadership and development. And we have 94 people on our mentor database at the moment. It's very successful. So this is our theory of change. So considerations at the system level require reform that we talk about a lot, of the cultural and historical factors affecting the organisation of healthcare systems. We believe a lot has to do with healthcare systems. If we change the system, hopefully things will change for us as Aboriginal and Torres Strait Islander people. So we talk about cultural responsiveness, practice at all levels of the system with processes of Aboriginal and Torres Strait Islander self-determination and clear pathways for inclusion of Aboriginal and Torres Strait Islander decision-making, ways of being, cultural considerations and ongoing development of cultural responsiveness. So this is something we can do. You can get onto our website and have a look at our cultural responsiveness framework, but you can see around the outside there's different things, but in the middle, all Aboriginal and Torres Strait Islander peoples are healthy, strong and thriving. We believe the outside has to be done for the middle to happen. So we talk about cultural responsiveness, not just cultural safety. Responsiveness means the action. What's the response? Pretty flash, these things. I get really excited when I see these. And I can press the button and it all happens in front of me. So in the past, Australian approaches to health and wellbeing have tended to be problem-focused and deficit. We talk about the deficit, we have to talk about solutions. You know the stats, we put the stats up all the time and it's really awful and people are shocked. Are people still shocked the next day? We go to conferences and people look at the stats and say, oh, how can that happen that renal disease is 4 or 5 or 6 times more for Aboriginal people? What happens the next day? Aboriginal people, we still have to live that, but what happens? Does anyone say, oh, we need to think about who we talk to about this? I do a lot of work in communities around water and access to food security. So what happens, I talk to researchers and say, when you go in communities, and I talked to researchers at a conference not long ago, and I said, how many people do research in Aboriginal communities? So many people put their hand up, very proud. And I said, who buys water in Aboriginal communities? They were still proud. And I said, what do you do about that? Why don't you drink the water? They're like, oh, it's awful. So, okay, have you done anything about that after you've gone back? And they're like, they weren't putting their hands up much then. But that sort of thing, like, you know, it's okay to say that there's a problem, but what are we doing about it? What are people doing about it afterwards? I won't get off track there. See me starting to get all worked up about that, hey, about the water thing. So looking at the doing, being and knowing, what are we doing? Our being, and we know. So what are we actually doing about this? So this is our cultural responsiveness in action, has to be in action. So we do a lot of workshops around the country for a lot of different associations, and we're looking at people's actions. We give people homework, and what is your action? What are you doing in the next 3 months? You got the information, what are you going to do with that information? Don't say you want change unless you're going to change it yourself to help us. This is something that's very, very exciting for us, is our Health Academy model. We got a small amount of Commonwealth funding to start this Health Academy model. So what it looks like is we've started one in the Northern Territory that's been very successful. We're going to have one in New South Wales, one in ACT and one in Queensland. Hopefully that will get bigger with more funding. It's about the Northern Territory-led training model. that is about tailoring training to ensure engagement, retention, success for Aboriginal and Torres Strait Islander students. So the model is designed to ensure training and education is delivered in a way that embeds the centrality of culture and holistic approach to health, as well as developing the technical capabilities. So there's multiple entry points and exit points. So there's, as you can see, Year 7 to Year 8, Year 9 onwards, they'll come in. They'll do a certificate. A certificate might be on the next one or the next one. So that's the different pathways. So there's plenty of pathways that the children, high school kids, can come into. We're not just saying it's allied health. There's all different pathways, so they can be anything in here that we encourage them to be. So this is what the Health Academy principles look like, and I'll get into the delivery in a minute. So education achievement and informed decision on health career opportunities. We help them with that. Where do you want to go? What do you want to be? Social and cultural determinants, support and mentoring. We think about what social and cultural determinants are barriers for our kids getting to school and doing education. So we make sure they got lunch, they make sure they got transport, they got uniforms, all these things that are barriers for our kids, we make sure all the barriers are knocked down. So Year 10 transition to Year 11 and 12, and Year 12 success completion. So we look at the transferable and flexible model. This has been really successful in the Northern Territory, how it's delivered. I'll get onto that now. So Cert 3 qualifications over 2 years, community and family involvement. We make sure the community's involved and the family's involved. It's a holistic approach, so making sure everyone's involved in this. There's a health career toolkit from Years 7 to 12 that we just developed at IAHA that we can have a talk about afterwards. I won't get right into that. From this academy, they have school-based traineeships, and they get paid for that. Some of the kids in the Northern Territory, 1 day a week, they'll come into our academy and they'll have their traineeships also. This was the only money coming into the household, so they'd be paid in these traineeships. They're the only person in the house working. That's a big deal for them, and it's a big deal for the family also. And taking that health and knowledge back to the family also. So wraparound supports, like I said, social and cultural determinants, cultural mentoring and Indigenous health perspectives. We make sure that we don't have enough Indigenous teachers sometimes to teach this, so we make sure that we do a lot of cultural mentoring with the teachers, and it's in a university setting, so the kids are comfortable. It's not in a school setting, the kids are comfortable, and when we help them for their pathway to go into university, they're already in the setting. So as I said, we're in talks with New South Wales at the moment, Queensland and ACT, there'll be one also. So leadership and self-awareness, to see them grow into young people and be really confident, which sometimes that doesn't happen in the mainstream education system, is really exciting for us. And professional role models. We have a lot of people come in and talk to them, and our board goes up and talks to them, and they have a lot of other professional role models coming in. And work experience and professional suitability. So this is something I wanted to quickly speak about too, and we have to remember this, that if we're doing programs or talking about Aboriginal health, it's all right to do programs and say put funds in communities, but accessibility, is there access for people to get food or get water in a community? Affordability, appropriateness of services, availability to whatever it is, cultural safe and responsiveness health services and education. And so the other thing is our future's in our hands for our children, and so we have to make sure that we have these things in place. We have academies, we have pathways to university for our kids. We just work together, and we talk about co-design. We have to make sure it's co-design, not just one way. And that's why this academy is really important for us, because we're the lead and we can have the say in what happens. So that's pretty much it. How'd I go for time? Good, very quick. Do you want questions now or have questions?
Yeah, no, we will. Well, thank you, Nicole.
Thank you.
Now, so were there any questions from the floor on the presentation? Like I had one. In the academy, you said it's in Darwin. I think it's Darwin.
Yep.
Does that service all of the territory or just
Yes,
Darwin?
yes. All of it. Oh, well, mainly just, I shouldn't say yes, mainly Darwin, but there was kids that come in, boarding school kids that come in from other areas that involved in our academy. And there was something else. There was 3 young girls 16-year-old girls that left high school and had babies and come back to school just to do the academy, which was really, really successful for us. So we're very, very proud of the academy, and because we know that sometimes we can't get a lot of our people to go to uni, we grow our own. So that's what we looked at, growing our own workforce to come into our academy.
Yeah. Okay. Right, now, well, Abby will bring around. You can just, if you don't mind, just saying your name. Oh, she's going down the back first. What have we got? Firing off everywhere.
Hey, I'm Kellyanne from Darwin, Flinders University, Poche Centre. So I'm just interested in knowing, once the kids are in the allied health courses, is there follow-on support while they're in their degrees?
Yes. So once they finish their course, we help them whatever they want to do. And most of the time, most of the NT ones have been offered work where they did their traineeships, which is great. Yeah. And we help them with going into university. Then they come onto our mentoring program within IAHA. Okay. So we have 88% retention rate of our students, our Indigenous students going through university. It's a lot higher than mainstream, so we have that mentoring program, so it's all followed through. They just come over to us as students then.
But it's not only university, it could be bachelor college or bachelor institute
yes.
or other training centres.
Yeah.
Sorry, now we've got one back down there, Carmen.
Hey, my name's Carmen Parder from Poche Centre, Sydney. Thank you so much for your presentation, and I'm really encouraged to see that you're embedding our knowledges and ways of being, knowing and doing into the work that you do. And I was just really interested in, because one of the things that's really challenging is to bring that knowledge and our cultural ways of being, knowing and doing into systems, and I'm interested in hearing the challenges that you had to do that.
I think there was lots of challenges with how do you teach non-Indigenous people how to change their ways and teach our Indigenous kids in a different way? So I think there was it's been a very, very interesting journey. And as you know, Donna Murray, CEO of IAHA, she's right into this cultural, ways of knowing, being and doing, and she was very strict on this is the way it has to be, and we've learned a lot from that. Things are different. It's not the same as it would be in mainstream education. I think that's what we've learned and embedded that in there, especially the cultural part. It has to be in the middle of it. Yeah.
Dawn.
Hi, thanks for your presentation. Dawn Besserup from Poche Centre at the University of Western Australia. I noticed that WA wasn't in the mix in terms of where you're actually doing the certificate course. Yep. So my question is that are the certificates a pathway into university, or do the kids do the certificate and then they have to apply to go into an Aboriginal course, or are they a pathway into a profession or a discipline in the university, or is that something that you're working on?
Yeah, working on it, but there is a pathway into university, and we will hopefully get to Western Australia. There's been a lot of interest from Western Australia, and it has to do with funding, of course.
Okay, well, working in the academy, I guess my other question was, have you then set up with, say, psychology or social work or whatever, so that when the kids do the certificate, they then can apply through the certificate course to get in? I'm just interested in terms of the pathway into those professions.
Yep.
Thank you.
And we already have the connections with all the associations anyway, which we do a lot of work with as a national organisation. And I'm not sure on that part with that part, but I can surely find out for you and get back to you. Yeah, which I'm sure Donna Murray's already looked at, which is probably already happening. Great. Oh, sorry. Yep. And we're happy to work with the Poche centres, which probably haven't, done a lot with Poche centres much around the country. So we probably need to do a lot more there with the Poche centres around the country.
But I think also for the Poche centres who have got Indigenous trainees, they should consider membership to IAHA because of the student program that you talked about and the support.
Yep.
Hi Nicole, thank you for your presentation. My name is Jill Romano and I work at the Attorney General's Department. Just would be interested to hear, you were talking about a co-design process when establishing the academy. What particular challenges did IAHA experience through that co-design process?
It was probably to do with the universities. So it was probably looking at the universities, because this is a bit different because it's Aboriginal led. And it's a bit different because a lot of the time the money comes from government. It has come from government to us, but a lot of the money's come from government, and they're saying, well, now we're going to co-design. How does that look? So it's a bit of a flip over, that we've got full control and making sure that we're the lead. We're making sure that culture is in the middle. Everything has to be done the way we want it to done. So I suppose that when I said the co-design, it's a bit different. We're the top, and everything else has to be exactly like Carmen said, the being, knowing, doing, that's the middle of it. There's no negotiation around that co-design. So I could talk about co-design for a long time because there's lots of different things out there. But looking at universities, how do they see it? How do they see this? Is very different for a lot of people to see that we make sure that it's all about culture in this. And it's about education, of course, but it's about culture. We have to make sure culture's in the middle of all this. Yeah.
Thanks again,
Thank
Nicole.
you. Thank you.
Appreciate it.
Thank you.